Welcome everyone to the Washington State TB Echo very special webinar in celebration of World TB Day. Thank you all for joining us today. My name is Lana K. Dove. I am one of the TB nurse consultants with the Washington State Department of Health, and it's my pleasure to welcome you. Next slide, please. Just a reminder, I'm noticing that folks are not able to rename yourself when you're an attendee. So go ahead and just pop in the chat your name and the facility that you're joining us from. This really helps with participant tracking. And, out of respect for embargoed data and the stories that are going to be shared today, please no screen snips or photos or recording with your device. And then we welcome questions throughout the entire session today. So feel free to pop those in either in the Q&A, or also the chat as well. I'll be cruising those while our presenters speak. And during question time, so that'll be after our TB survivor interview, you will have the chance to raise your hand and we can unmute you towards the end of the session. And you should have also received an email. You will receive one shortly thanking you for joining us today with a link to the evaluation in order to claim your continuing education units. We received those continuing education units from Curry International TB Center, and we want to thank Curry right now for partnering with us on our TB Echo project, and especially this special World TB Day. All right, and with that, I have the pleasure of introducing Dr. Bijan Gassamieh. He is our TB Echo Medical Director and an attending physician in pulmonary and critical care at the University of Washington Medical Center. He's also a staff physician at the King County TB program, and he's definitely my favorite person to poke at during these sessions, so I'll hand it over to him.
Thanks, Lana, and thanks everybody for joining us on our special World TB Day celebration, and using a little bit different format with Zoom. So if you're having any issues, please put that in the chat. We can try to help you. I'm just going to spend a few minutes talking about World TB Day and then putting a plug in for our Echo, and then we're going to go on to the important stuff, which is a few talks, one by Kelsey Houston, who's our epidemiologist from the Washington State Department of Health, and then really important talk with Nicole Skaggs and Tiffany Salinas talking about Tiffany's experience with TB. So next slide, please. So what is World TB Day? World TB Day, as you all know, is March 24th. It's the day that Koch announced the discovery of the TB bacillus in 1882. The 2024 slogan, which is the same as the 2023 slogan, is "Yes, we can end TB." And the stated goals for World TB Day are to raise awareness and share successes around TB, but then also stimulate further work toward TB elimination. We are trying to do that in a small way with our talks today and a small way with our weekly Echo sessions. Next slide, please. So just a brief plug for our Echo sessions for those of you that are joining for our special World TB Day event, but don't join our weekly sessions. So Echo stands for Extension for Community Health Healthcare Outcomes. It was developed at the University of New Mexico for viral hepatitis, but now it's expanded to many different diseases in many different institutions, including the University of Washington. I think there's somewhere along the lines of 10 or 15 different Echoes at UW only. Participants present their cases virtually and then receive guidance from and support from the broader Echo community, and then also our expert panel. We also offer didactic sessions that do include CME. Next question, please. So when are the sessions? They are Mondays. No, they are Tuesdays, 12:30 to 1:30. So let's edit that. It used to be Mondays. Now they are Tuesdays from 12:30 to 1:30. It's free. Again, case reviews and didactics and mentoring, and CME is available. I got to stop touching my face, I see from that screenshot. I'm doing it right now. All right, next slide. So who participates? Quite a few people from from Washington State, which is our goal. It is meant to support clinicians in Washington State, but also people have been joining nationally, and we're happy to have some expertise coming not just from our local experts, but from some national experts on the call. Next slide. So this is the website. If you want to sign up, again, it's Tuesdays from 12:30 to 1:30, and we would love to have you. You can put any questions you have specific to Echo in the chat, and I'll get back to you. Next slide. And then I'm going to stop talking, and we'll move on to our important stuff. So our first presenter is Kelsey Houston. She is an epidemiologist for the TB control program at the Washington State Department of Health. She started working in TB in January of 2021 after graduating from the University of Washington MPH program. She primarily works with the Washington Disease Reporting System, or WDRS, and Program Evaluation Metrics. She lives in Portland, and in her free time enjoys exploring the Oregon coast, trying new restaurants, and traveling. Kelsey, take it away.
Great, thank you. I'll just share my screen. All right, can you all see that?
Yes.
Great. Hello, everyone. My name is Kelsey Houston, and I'm an epidemiologist with the tuberculosis program at the Washington State Department of Health. And today I'm going to be providing a brief overview of tuberculosis epidemiology in Washington State. And this is going to help orient us all to the topic before our featured speaker presents. And again, to ensure that we stay on schedule, kindly ask that questions on the information presented here either be held until the end of all presentations or be discussed offline. And I'm going to have a slide at the end that contains contact information for the Washington State TB program, should you have any follow-up questions and want to get in touch. And thank you for your understanding. I have nothing to disclose. And our objectives for this presentation are to describe TB trends in Washington State and use TB epidemiology data to identify populations at risk for LTBI and TB disease and improve timely diagnosis. A few key points for this presentation. On average, 4 cases of TB disease are diagnosed in Washington each week. TB disease occurs in most areas of Washington and is more concentrated in urban areas. And TB disproportionately affects vulnerable populations in Washington. This graph displays reported tuberculosis, or TB, disease cases for the last 30 years in Washington State. The bars indicate the case counts for each year, and the dashed line is a linear trend line for this data. You can see that over the last 30 years, case counts are trending downwards overall, with fluctuations from year to year and increased fluctuations in recent years. In 2020, there was a significant decrease in cases with a case count of 163, followed by significant increases in 2021 and 2022, with 199 and 251 cases respectively. And this past year, in 2023, there were 221 cases counted in Washington State. There are several factors that likely influence these recent fluctuations, including COVID-19, Department of Corrections outbreak, and other TB clusters. This slide shows TB case rates over the last 30 years. The solid blue line represents Washington rates. The dotted purple line represents the US rates, and the dotted gray line represents the target case rate for 2025 and the goal of TB elimination. Over the last 30 years, incidence rates in TB in Washington have progressed downwards overall. And more recently, as we discussed, there was a decrease in case rate in 2020, followed by increases in 2021 and 2022, and then a slight drop this past year in 2023. In 2023, the TB case rate in Washington was 2.8 cases per 100,000 persons. And the US 2023 data will be available once CDC publishes the annual MMWR regarding tuberculosis, and that's currently expected on March 28th. And in 2022, the US case rate was 2.5 cases per 100,000 persons. And like we previously discussed, these recent fluctuations in case rate can be partially explained by the impacts of the COVID-19 pandemic, an outbreak in Washington correctional facilities, and a few other TB clusters. This map illustrates average TB case counts over a 5-year period in Washington counties. Counties in dark blue have an average of more than 10 cases of TB reported per year. Counties in teal have an average of 5 to 10 cases of TB reported per year, and counties in light blue have less than 5 cases of TB reported. We have included average case counts for Snohomish, King, and Pierce counties to differentiate counties with more than 10 cases. Snohomish had an average of 25 cases, King 109, and Pierce 23 cases over this 5-year time frame. And you may notice that very few Washington counties are shaded in gray, which here represents those counties with no TB disease cases over this time period. Therefore, TB disease occurs in most areas of Washington and is more concentrated in urban areas. And this slide shows TB case rates by age group and sex at birth. Males are shaded in yellow and females are shaded in blue. From 2019 to 2023, higher case rates of TB were experienced by males compared to females. And over the same time period, when stratified by age group and sex, as presented here, males age 65 and over experienced the highest case rate compared to all other groups, with 5.5 cases per 100,000 persons. There are many risk factors to consider when thinking about TB in Washington, and this slide shows the prevalence of the top 5 risk factors among Washington TB cases from 2019 to 2023. When we talk about risk factors for tuberculosis, these can be risk factors for being exposed to and infected with TB, or they can be risk factors for progressing from TB infection to TB disease. Please note that individuals may fall under more than one risk category. From 2019 to 2023, Washington residents born somewhere other than the US and its territories accounted for 73.8% of TB cases in Washington, and TB is more prevalent in certain parts of the world other than the US, and therefore risk of exposure to TB is greater for people in those areas. Certain medical conditions can lessen the ability of the immune system to keep TB infection from progressing to TB disease, and diabetes is one example of this. 22.1% of TB cases in this period had a diagnosis of diabetes at or before their diagnosis of TB. During the same 5-year time period, 11.9% of TB cases in Washington were a known contact of a person with infectious TB within 2 years prior to their TB diagnosis. Like the first risk factor mentioned here, this relates to a greater risk of exposure to TB. 5.5% of cases during this time had reported excess or heavy alcohol use in the year prior to diagnosis, and substance use can impact the immune system and is another risk factor for progression from TB infection to TB disease. Lastly, 4.5% of cases during this time reported experiencing homelessness in the year prior to their diagnosis, and congregate settings can increase likelihood of exposure to TB. And these are just a few examples of risk factors for exposure to TB and progression from infection to disease. And recently in 2023, there was a major update to the reporting form for TB disease. So we now have a few additional risk factors that we can take a look at, including homeless ever, smoking status, viral hepatitis, pregnancy, and others. So more to come with this new data. And TB can occur anywhere in the body and can present in different ways. From 2019 to 2023, 74% of Washington TB cases had pulmonary involvement, and 26% of cases had only extrapulmonary sites of disease. In the graph to the right, you can see the further breakdown of extrapulmonary disease sites among Washington TB cases. And after this presentation, we're going to hear from a TB survivor who had both pulmonary and extrapulmonary TB. And in most cases, tuberculosis is treatable and curable. However, TB can be fatal if not properly treated. And among TB cases diagnosed in Washington from 2019 to 2023, approximately 7% of patients died before diagnosis or during treatment, and about 5 of the 7 deaths were attributed to TB disease or TB treatment. And early and accurate detection of TB is important to reduce TB deaths in Washington. And just quickly wanted to give a shout out to CDC's Think, Test, Treat TB campaign to increase testing and treatment for latent TB infection in the US. And more information can be found by following the hyperlink on this slide. And as mentioned earlier, World TB Day is observed each year on March 24th. And the Stop TB Partnership is continuing last year's theme, Yes, We Can End TB. And it reminds us that we have the collective power to end TB, and we've made great progress so far, but there's still a lot of work to be done in eliminating TB. And please feel welcome to contact us at the State TB Program. Our contact information is listed here and is also available on our website, which you can reach by searching for the Washington State Department of Health TB Program or by navigating to the URL shown on this slide. And thank you so much for being here today and for letting us share this information with you. And again, please keep any questions until the end of all presentations. Thank you.
Thanks, Kelsey, for that great presentation. We're going to move on to our second part of our World TB Day event, which is an interview with a TB survivor. I'd like to introduce Nicole Skaggs, who is a TB survivor and advocate affiliated with We Are TB. She is also a volunteer patient advocate with TB Echo. She joins our panel and has a lot of good insight, and also works as a property manager. World TB Day marks the 1-year anniversary from her release from a 4-month TB isolation period. And she is going to be interviewing Tiffany Salinas, and I'll give Nicole the honor of introducing Tiffany. So please take it away, Nicole.
Thank you very much, Dr. Gasmier. So I want to start first by thanking everyone for allowing us this space to talk about TB patient experience. And Tiffany and I are both affiliated with a group called We Are TB. And I just want to do a little quick plug for We Are TB. We are patients and survivors, and we serve to support patients in treatment. So please use us as a tool for any patients you have going through TB treatment, late or active, and then beyond as well as advocacy. Next slide, please. We do not have any conflicts to disclose. And then next slide is going to be our objectives for this discourse. I'll let you guys read those all. And then I will introduce our keynote speaker of the hour. Is going to be Tiffany Salinas. She is a survivor and advocate for We Are TB. She's a 4-year TB warrior who had active meningeal TB and pulmonary TB. And she's going to share her experience from diagnosis, treatment, recovery, and how she relearned to walk and fight for her life. Tiffany is an experienced marketing professional in Texas. She's also a mom to 6 rescue fur babies and loves to travel and thrift on her free time. So thank you so much for being here, Tiffany.
Thank you for having me. I'm excited.
We're so happy that you're willing to share your story with us, and thank you for being brave enough to share your experience. So to start, can you tell us a little bit about what your diagnosis and treatment looked like?
I will start in 2019 when I started experiencing symptoms of started off as a really bad headache. I suffer from migraines, but this was a different type of headache. I was there one day at work and my coworker gave me some headache pills and it just wouldn't go away. It was a different type of headache. So the headache lasted maybe a couple days, and then the other symptoms started coming on from 103 degree night sweats almost every single night. I was drenched in sweat, started to have a loss of appetite, and my energy started to dwindle. So I went to a primary care doctor because I don't like being sick or missing work. And this is during the beginning of COVID. So I went and I got diagnosed with an immune deficiency. And she told me basically that there was no cure and that I just needed to hydrate myself and eat healthy foods and just get rest. And that it would eventually, and take vitamins, and eventually I would get better. Well, unfortunately, I got worse and worse and worse to where I completely had little to no appetite. I was stuck in bed. I was mostly asleep most of the day. I couldn't wake myself up. I was having very weird dreams. no energy. I had like 4 or 5. I had to make myself eat banana chips a day. And I could hardly even get up to use the bathroom. Before I got sick, I was a very active person. I was working out 3 times a week, doing things with my friends and my family, shopping. For me to not have any energy at all was not like me. I don't like to sleep. I rather be outside doing things, enjoying the day. And so I just started to get progressively worse and worse and worse. And I was at work one time. We had a couple of us came into the office for a meeting, and one of my coworkers said, "You look gray. Your skin is gray." And I'm like, "Well, something's not right. My skin should not be gray." And I went back home and started getting more worse and worse and worse to where I couldn't move at all. My dad came in. He's like, "We're going to the emergency room," and I hate doctors. And I told him, I was fighting with him. "I don't want to go. I don't want to go." He's like, "We're going." And finally, I decided, I can't live like this, being bedbound. I can't live. I need to know what's wrong with me. Not it's not an immune deficiency. So I got up and started trying to get ready to go to the ER, and I passed out backwards and hit the back of my head very hard on the ground. Um, my dad called the ambulance to come and get me, and this is during COVID. And they told me and my family that I had COVID when I knew very well I hadn't, because I'd not left the house. And then the rest is kind of a blur. I just remember kind of being in an ambulance and them telling me that this is a life and death situation. And I remember getting to the hospital and them not having a bed because this is during COVID. And I was waiting for a place for them to put me in. And then the next moment I know, I wake up and I'm in a dark room with lights and beeping and unable to move and all these wires connected to my body.
That's a lot. And I can only imagine how hard that was. How did all of these challenges affect your mental health, and who supported you through all of those challenges?
Well, when I woke up, I was told that I was paralyzed and I couldn't speak. So mentally, I was felt like a shell inside of my body because I couldn't express myself. The only thing I could do was move my eyes. And I remember the ICU nurse took my hand and he could see that I was terrified because I didn't know what was happening. I was confused. He took my hand and he told me, "Do you believe in God?" And I shook my head, and he's like, "Let's pray." And he held my hand and I just blacked out. Um, and I remember I hear him praying and I was praying and, silently. And I remember feeling this presence, and I just believe it was God. And I told him, "Please let me live. I promise if you let me live, I will, from this day forward, try to help as many people as I can on earth to give them hope and save lives if you bring me back to life." And I felt like a rush, like everything was going to be okay. And I woke up. And from then on, I progressively got better and better and better. And I was told I was moved from ICU to another room, to a regular room. And I was told at this time that I had tuberculosis, um, meningitis, and pulmonary. So I had it in my brain and I had had a stroke. And so with the hospital started physical therapy with me and speech therapy because I couldn't speak. And let me tell you, learning to speak again was a challenge because I remember she was telling me, just to like gutturally scream so I could start getting my voice back. And I would do those exercises, just trying to like just make guttural noises so I could learn how to speak again. And you don't know how precious walking and talking is until you lose it, and how hard it is to get it back. So mentally, it just and physically messed with me. Again, this was during COVID, so I could not. I had no visitors. I was by myself, scared out of my wits. All I had was a doctor that was talking to me, and a nurse that was really, really nice and kind to me. Because I had really bad days there. I was in Memorial Hermann in Houston, and I started to get better. Started a little bit of physical therapy in my bed, and then at that point, when I was about to get released, maybe 3 or 4 months later, my doctor told me he gave me an option to go home or to be released to the Texas Center of Infectious Disease. And I asked him, if I go there, will I be better? Will I be like back to where I was? And he's like, they'll help you. So I wanted to go home so bad because I was so lonely and I was scared, but I didn't want to live as a paralyzed person and be as sick as I still was. So I agreed, and then I was put on a waiting list. I waited 3 months to be accepted into TCID. And then from there, I got transported by ambulance to San Antonio. And I remember my first night there, I had a fit. I was screaming that I wanted to go home. I called my parents, and my parents were a lot older and they couldn't take care of me. And my dad's like, you're not going home. You're staying there until you can, basically take care of yourself. So I didn't want to be there. But the nursing staff would come in and talk to me, and they're like, you really need to stay, because I was basically, when I got there, at death's door. Very, very bad off. I was about 120 pounds. I'm 5'10", so my healthy weight is like 160 to about 190. So I was like skin and bones because I had a feeding tube. I wasn't on solid food yet, feeding me, and I couldn't walk, so I was like strapped to a bed, and my muscles were atrophied. And so my doctor started, I guess, concocting different drugs that would tackle it since it was so aggressive in my body. She had to find the right mixture that would take care of it. I remember it took a while, and finally she found the right thing. And during this time, mentally, I was a wreck. I started to have panic attacks, which, let me tell you, the first time you have a panic attack, I was scared out of my wits. I thought I was dying. I was screaming that I was dying. All the nurses were like coming into my room. I didn't know what was going on. I'm like, I wanted to get out of my body. And to tell you, I was tearing at my skin to get everything out of me. It was the worst experience ever, because I didn't want to be here anymore. I didn't want to be, I just wanted it all to end. And I just can't say enough for the Texas Center for Infectious Disease. They helped me through everything. And to say I was bad, if my doctor was here, she would tell you that they didn't think I was going to make it, or even walk again. So because of that support system that I had of my nurses, my physical therapist, my respiratory therapists, and my doctor, I would not be here talking to you today. It's just, I can't tell you medical professionals enough that if you just, it's not only the medicine, but it's the care that you put to your patient. The medicine can do so much, but mentally, I had my nurses just sit there with me and hold my hand. And to tell you how much that helped when I felt so alone and I wanted to die. I think that's the reason I'm here today, because of that love they gave me, and answering any questions, even sometimes they were stupid. And one time I called the nurses station 99 times because I was having panic attacks, probably every hour. So I had a psychologist and a psychiatrist that would come in and speak to me. They put me on medications, which I just think medications for psychological problems are for crazy people, but I didn't like being on them, but I couldn't control myself. And I didn't know that that was because I had TB in my brain. And they didn't tell me this completely till I was released because my mental status was so fragile. Let me just say that.
That is an unbelievable story, but also an unbelievable story of hope, because I've had the pleasure of getting to know you as an amazing, vibrant woman. So to kind of end this on a positive note, is there anything that you can tell our audience of medical professionals that they can maybe share with their patients that can help those patients be inspired in their journey, just like you were in?
Yes, I would say tell all your patients, just be there for them. TB, I mean, to be diagnosed with something that most people think is a disease that was back in the 1800s, and people these days never get to find out that you were diagnosed with that, and to not be sure what it all attributes to just like kind of sit there with them and talk to them, and answer any questions they may have, because to this day and age is why we're here, is TB is, people don't believe it's still around. And I think reason Nicole and I are here and all of y'all are here is to get the word out that TB is still around. And it just really pisses me off that people get misdiagnosed like I was and die. And I think as a medical professional, us as people put our faith into you, thinking that you're doctors, you know everything, and you're here to help us and help us get better because you take the Hippocratic Oath, and to be misdiagnosed and almost die and not be here today and maybe be in the ground. I just think that, if my speech can get to somebody that's misdiagnosed and they find out that they have TB and it saves their lives, then everything I went through, which was horrible, that I wouldn't wish it on anybody. It was like a nightmare. Then I have completed, it all makes it worth it to me, just to help and touch other people. So as medical professionals, all I can say is just talk to your patients and just be there for them. And sometimes all they need is somebody in front of them just to hold their hand and say, it's going to be okay. We can make it into fight.
It's a really beautiful message that a small action can make a really, really big impact. And with that, I'll pass it back to Dr. Gasmi for questions.
First, I just want to say thank you, Tiffany, for sharing your story. It must not be easy to talk about really difficult times, and we appreciate you doing it.